As the world's leading provider of evidence-based scientific and medical content, Elsevier offers clinical solutions at every stage of a patient's journey that empower healthcare providers to make better decisions, deliver better healthcare, and save lives. Meet Mr. and Mrs. Elliott, whose journey begins when Mrs. Elliott enters the ED with a head injury after a fall. As the ED nurse does a physical assessment, the ED physician reviews the patient's profile and sees that Mrs. Elliott is a non-smoker, in generally good health, with no family history of serious medical conditions. However, Mrs. Elliott's husband explains that his wife has recently been experiencing confusion and memory loss. Based on this information, the ED physician uses Elsevier's order sets for head injury, which includes the option of a head CT. And the nurse initiates symptom-based care plans using Elsevier's care planning. The nurse also validates the procedure for placing an IV for the patient using Elsevier Clinical Skills. While reading the CT scan, the radiologist sees 2 enhancing brain lesions with associated edema. They don't appear to be trauma-related, so the radiologist consults the StatDX Diagnostic Decision Support System to perform a differential diagnosis. Based on the results, she believes the lesions are likely to be brain metastases from an unknown primary site. The medical oncologist is notified of the radiologist's findings and uses Clinical Key for current information on brain metastases. She admits Mrs. Elliott to the medical surgery unit, starts her on IV steroids, and orders CT scans of the chest, abdomen, and pelvis. The nurse uses an Elsevier care plan to assess Mrs. Elliott and provide her with information about safety in the unit. The nurse also educates her on the purpose and benefits of the CT scan using an easy-to-read patient engagement handout. After the CT scans reveal lung and right adrenal masses, the interventional radiologist consults StatDX to confirm that a CT-guided core needle biopsy of adrenal mass is the best approach. Tissue from the biopsy is examined by the pathologist, who uses 2 Elsevier decision support tools: ImmunoQuery, which helps determine the best antibody stains to narrow the differential, and ExpertPath, which helps confirm an adenocarcinoma consistent with lung cancer. With this diagnosis, the medical oncologist pulls up a VIA clinical pathway for current information on staging and treatment. She calculates a stage of 4B, and follows the pathway recommendation as she orders a genomic analysis of the adrenal met and a PD-L1 stain. When an actionable EGFR mutation is revealed, the medical oncologist reviews the pathway again, which leads her to a treatment plan that includes the drug erlotinib. She then uses clinical pharmacology to review the drug's mechanism of action and potential side effects. As Mrs. Elliott prepares to go home, the nurse uses a patient engagement handout to review self-care and management of her condition at home. In the weeks that follow, Mrs. Elliott responds well to the drug treatment and continues to see her primary care physician on a monthly basis to monitor the disease and its side effects. In addition, a nurse care manager initiates a wellness care plan using Elsevier Care Planning Ambulatory to promote continued health for Mrs. Elliott in the future. Throughout this patient journey, Elsevier Clinical Solutions provides the care team and the patient with trusted, current, evidence-based content. We invite you to learn more about how Clinical Solutions can support your institution drive standardization, increase efficiency, and improve outcomes.